Right now, inside your body, there may be a hidden fire burning. You can't feel it like a normal fire. It doesn't make you sweat. But this fire, inflammation, silently damages your cells, weakens your defenses, and makes it easier for cancer to grow. Most seniors I meet think inflammation is about arthritis pain, sore joints, or swelling. But here's the shocking truth. Chronic inflammation is one of the most powerful triggers of cancer. And unless you take steps to control it, this fire can spread through your body for years, feeding tumors before you even know they exist. Today, I'm going to explain how inflammation feeds cancer, the surprising everyday habits that fan the flames, and exactly how you can put out this fire, starting today. Stay with me, because once you understand this connection, you'll see your health, your food, and your future in a completely new light. Alright, let's clear up one of the biggest misconceptions. When I say inflammation, most people think of a swollen knee, a sprained ankle, or maybe arthritis pain. That's what we call acute inflammation. It's your body's short-term emergency crew, redness, swelling, heat. You cut your finger, it gets puffy, then it heals. That's normal. That's healthy. But there's another kind, the one that really worries me as an oncologist. It's called chronic inflammation. This is when your immune system never really shuts off. Day after day, it keeps dripping out little chemicals called cytokines, along with free radicals. Over time, those signals don't heal you, they hurt you. They damage your DNA, irritate tissues, and create the perfect breeding ground for cancer cells to grow. Here's the picture I want you to hold in your mind. Think of a campfire. A small flame on a chilly night is comforting, useful. But if you walk away and leave that fire smoldering for weeks, eventually, it spreads into the forest. It burns down trees, destroys the land, and leaves destruction everywhere. That's exactly what chronic inflammation does inside your body, especially after 60. A little spark becomes a fire that spreads silently, damaging cells, aging your tissues, and setting the stage for cancer. And here's the truly frightening part. You may not even feel it. No pain, no fever, no obvious warning sign. You could be walking around, going about your day, and meanwhile, that invisible fire is quietly fueling cancer's growth. So the question is, what's causing this fire to stay lit in seniors? And how can you put it out before it spreads further? Stay with me, because the answers may surprise you. Let's go deeper into the biology. When you have chronic inflammation, 3 things happen that set the stage for cancer. 1. DNA damage. Free radicals created during inflammation break DNA strands. Damaged DNA equals mutations. Mutations equals the seeds of cancer. 2. Immune system exhaustion. Chronic inflammation makes your immune system tired. The very cells that should attack cancer, T cells and natural killer cells, become sluggish. 3. Angiogenesis hijack. Inflammation stimulates new blood vessel growth. Cancer cells hijack these signals to build their own blood supply, fueling tumor growth. This isn't theory. It's documented in studies from Harvard, NIH, and major cancer centers. In fact, researchers estimate that 1 in 5 cancers worldwide is directly linked to chronic inflammation. But what's causing this fire in seniors? You might be shocked to learn it's not just smoking or alcohol. It's often your daily food, your lifestyle, even the medications you're taking. Here's the hard truth. After 60, inflammation doesn't just get more common. It gets more dangerous. Let me break down why. Reason 1, immunosenescence. That's a fancy word for an aging immune system. As you get older, your immune system loses precision. It makes more mistakes, attacking healthy tissue, missing abnormal cells, and those errors create a steady drip of unnecessary inflammation. Reason 2, visceral fat. Belly fat is not just extra weight. It's biologically active. It actually secretes inflammatory chemicals that circulate through your blood. Think of it as a factory constantly pumping out fuel for cancer. Reason 3, common conditions. After 60, many seniors live with diabetes, heart disease, obesity, or arthritis. Each one of these diseases is already linked to chronic inflammation. Add them together, and the fire inside your body burns hotter and longer. Reason 4, medications. And here's one most people don't realize. Even some life-saving medications, like statins for cholesterol or steroids for inflammation, can shift the way your body regulates these pathways. They help in one area, but can quietly stoke inflammation in another. I'll never forget Richard, a 70-year-old patient. He walked daily, never smoked, ate what he thought was a decent diet. On the outside, he looked healthy. But when we checked his blood work, his CRP and IL-6, key markers of inflammation, were sky high. Just months later, he was diagnosed with colon cancer. That silent fire had been burning for years, hidden under the surface. That's the danger for seniors. You can feel fine, even look fine, while inflammation is secretly building the perfect environment for cancer. So the real question is, what's fanning these flames every single day? And how do you put them out before they spread further? Let's dig into the surprising triggers most seniors overlook. What fans the flames of inflammation? Some of these may surprise you. Sugar and refined carbs. Cookies, pastries, white bread, they spike blood sugar, leading to insulin surges and inflammatory chemicals. Processed meats. Hot dogs, bacon, deli slices, filled with nitrates that fuel inflammation. Cooking oils. Cheap vegetable oils like corn and soybean are high in omega-6 fats that imbalance the body and trigger inflammation. Hidden stress. Constant worry raises cortisol, which raises inflammatory markers. Poor sleep. Less than 6 hours a night boosts CRP, a key inflammatory protein. And here's the scary part. Sometimes the healthy foods marketed to seniors, flavored yogurts, packaged oatmeal, protein bars, are secretly loaded with sugar and oils that pour gasoline on the fire. You know, I've seen this play out time and time again in my practice. Seniors who felt stuck, like their health was only headed one direction, turned things around dramatically by doing one simple thing: tackling inflammation head-on. Case 1, Margaret, 68. She came to me right after being diagnosed with early breast cancer. Like so many, she was scared, overwhelmed, and felt like the diagnosis meant she had no control. We focused on her diet. Out went the processed crackers and packaged snacks. In came fresh berries every morning and salmon twice a week. Within 6 months, her inflammatory markers, the blood tests that measure the fire in your body, dropped by nearly 50%. Her energy returned, her mood lifted, and her doctors told her she was responding better to treatment than expected. Case 2. David, 74. He battled prostate issues and was right on the line of prediabetes. He wasn't sure small changes would matter at his age. We cut back on hidden sugars, swapped his cooking oil for olive oil, and added a cup of turmeric tea each evening. The results? His blood sugar normalized, his PSA stabilized, and he told me he felt more in control of his health than he had in a decade. Case 3. Ellen, 80. She laughed when I first suggested lifestyle changes. At my age, is it really worth it? But she gave it a try, joined a senior walking group, loaded her plate with leafy greens, and cut her nightly glass of wine down to just a few times a week. A few months later, her doctor looked at her labs and said, "These look better than they did 10 years ago." And here's the truth. These aren't miracles. They're not luck. This is pure biology. When you reduce inflammation, you stop feeding cancer and start giving your body back its natural power to fight. So the real question is, if these seniors could do it, starting in their late 60s, 70s, even 80s, what could happen if you made these changes today? Okay, now let's roll up our sleeves and get practical. You've heard how inflammation feeds cancer, but the good news is, you have the power to put out that fire. Here's your anti-inflammation cancer defense blueprint. 1. Food as medicine. Your grocery cart is your pharmacy. Berries, blueberries, strawberries, blackberries. Their anthocyanins actually lower CRP, one of the biggest inflammation markers in your blood. Tomatoes, rich in lycopene, proven to reduce inflammation in prostate and breast tissue. Fatty fish, salmon, sardines, mackerel, packed with omega-3s that directly neutralize inflammatory omega-6 fats. Leafy greens, spinach, kale, arugula. These are loaded with antioxidants that mop up free radicals. Turmeric with black pepper. This combo supercharges curcumin's ability to cut down inflammatory cytokines. 2. Lifestyle habits. Sleep. Aim for 7 to 8 hours. And yes, total darkness matters. Melatonin is not just a sleep hormone. It's an anti-inflammatory shield. Movement. You don't need marathons. A simple 30-minute brisk walk most days lowers inflammatory markers dramatically. Stress control, meditation, prayer, journaling. Even a few deep breaths calm cortisol, and cortisol is one of the sparks that fans the fire. Gut health. Your microbiome is like your inflammation thermostat. Probiotics from yogurt, kefir, or kimchi help cool things down. 3. Medical guidance. Ask your doctor to check your CRP and IL-6. If they're high, that's your body telling you the fire is active. Review your medications. Some may quietly add to inflammation. Work with your physician to adjust if needed. But here's the catch. This only works if you stick with it. You can't sprinkle turmeric once, eat one salad, or walk one afternoon and expect miracles. Consistency is the extinguisher. Because if you slip back into sugar, processed foods, and sleepless nights, the fire reignites. So the next question is, what are the everyday mistakes most seniors make that accidentally cancel out all these benefits? That's what we'll tackle next. Many seniors unknowingly sabotage their progress, relying on supplements instead of real food, popping pills but still eating processed snacks, overusing NSAIDs, temporary relief, but can harm the gut lining and increase inflammation. Thinking exercise has to be extreme. It doesn't. Gentle, consistent movement beats occasional hard workouts. Ignoring sleep. No diet can fix inflammation if your nights are broken. Each mistake pours gasoline back onto the fire. But the good news? Every one is 100% fixable. Here's the truth. Inflammation is not destiny. It's a process. And like any process, it can be turned up or down. When you eat sugar, processed meat, or sleep poorly, you fan the flames. When you eat berries, sleep deeply, walk daily, and reduce stress, you put water on the fire. Every choice either fuels cancer or fights it, and you get to decide which one.